Welcome to the Specsavers Clinical Placement Supervisor Orientation, a resource designed to assist you in preparing for hosting students and guide you through what good looks like when it comes to clinical placement. Firstly, thank you for hosting a student. We recognise this requires a significant commitment from you and your team, and we're grateful for your involvement in training the next generation of optometrists, as are the university staff and the students themselves. Their experience while on placement affects students' perceptions of your store and the Specsavers brand overall, and influences their decisions regarding employment, so it is essential that each and every placement is a great one. It is equally important that you, your team members, and the patients who attend your practice also have a positive experience. This video will guide you through best practice to support you in ensuring a great experience for all involved. The areas we will cover are the overall roles and responsibilities of supervisors, how to prepare for the student's arrival, potential activities to be completed during placement, effective communication and feedback, and other considerations to allow you to seamlessly integrate supervision into your practice. Student placements in community optometry practices are intended to complement the clinical experiences that they get in university clinics and other environments. Whilst on placement, it is expected that students will expand and apply clinical knowledge and skills acquired at university into real-life situations, gain experience in an authentic workplace setting in order to develop into work-ready graduates, and understand all elements of the practice, including patient journey, roles of team members, overall operations, and how the practice fits into the community. As clinical supervisor, you have a role in helping students achieve these objectives. Clinical supervision has its own skill set, which is distinct from clinical skills. It is the oversight of professional procedures performed by a learner for the purpose of guiding, providing feedback on, and assessing personal, professional, and educational development. Clinical supervision incorporates elements of mentoring, coaching, and teaching. The core competencies for clinical supervisors within the healthcare sector are outlined in the National Clinical Supervision Competency Resource, developed by Health Workforce Australia. They are preparation and planning, including defining roles and the supervisory relationship, and clarifying learning outcomes. Facilitating learning, focusing on experiential learning, feedback, and assessment. Problem solving, identifying and preventing problems and managing issues. Communication, expressing thoughts and ideas, providing opportunities for questions and feedback, and managing conflicts. Safety and quality, abiding by legal, ethical, and professional standards, identifying and minimising risks to patients, students, and supervisors. And organisation, managing all responsibilities, effectively integrating supervision into clinical practice. As we proceed, we will address these general competencies as well as focus in on how these apply within the optometry industry and more specifically within the Specsavers model. It's important to understand what is expected of you as supervisor. What does good clinical supervision look like within our model? Lead by example to transfer knowledge and skills. Assist the student in learning the practice of optometry by acting as a role model. Attempt to provide exposure to all aspects of professional optometry, both clinical and non-clinical. Providing this diversity of experience help builds more skill sets. Coach, encourage, and challenge the student to help them develop capabilities and skills. Inspire learning and guide personal, professional, and educational development. Provide constructive feedback and reassurance, and expect and enforce appropriate, respectful, ethical behaviour and high-quality patient care. As supervisor, you are ultimately responsible for patients seen by the student you are supervising. Within the context of a patient examination, the supervisor is responsible for ensuring that the student instructs patients correctly, selects appropriate clinical tests, performs those tests accurately, interprets findings correctly, arrives in an appropriate diagnosis and management plan, recognises when referral or further testing is needed, writes reports or referrals when necessary, and records results properly. Preparing for placement is essential to ensure you get the most value out of your time when you actually arrive in store. Before the student arrives, you should review the university guidelines and return any required documentation. Ensure you've spoken to the student. They should contact you, but please contact your graduate recruitment consultant if you haven't heard from the student prior to their expected start date. When you speak to the student, confirm their days and hours of attendance. Provide details of your store location and the car parking or public transport options. Discuss expectations regarding uniform or dress code. And provide your contact details so they can advise you in case of absence or lateness. It's also important to ensure the store team is aware of the student's attendance and trained on patient selection criteria and customer-facing conversations. Set up the appointment diary for the student and adjust the supervisor's appointments to allow time to review patients seen by the student if applicable, and also set up the consulting room for the student if applicable. While each placement journey will be different because each store is different, each university has different requirements, and each individual student is different, the general progression will be similar. Comprehensive onboarding process is the essential first step for any placement. The student will then be ready to progress through observing and performing elements of the patient journey, clinical observations, and patient examinations. Typically, the student will start slowly. As they settle in and gain experience, gradually increase their exposure to a full range of patient experiences. The induction experience is essential to ensure the student feels engaged and part of the team from day one. Refer to the in-store portion of the orientation checklist and ensure you take them on a tour. Show them around the store, including the consulting rooms, visual fields area, contact lens teach area, and also the shopping centre. Show them where the toilets are, where to get the best coffee, etc. Introduce them to the team and explain the roles of each team member. Align expectations. Find out whether the students worked in a Specsavers store. What are their strengths? What are their areas requiring development? What are their goals while on placement? And also advise what you expect while they're on placement with you. And help them develop a learning plan that is manageable, realistic, and appropriate given the duration of the placement. Following the initial onboarding phase, the student should become familiar with the patient journey. Shadowing patients through the entire journey is a valuable learning experience, as is performing all of the elements. As well as the standard parts of the patient journey, the student may also observe and perform visual fields tests and contact lens teachers. In addition to learning to perform the skills associated with these elements, immersing themselves in all elements of the patient journey should also help the student to understand the benefits of delegation, the concept of role in clinics, and the importance of teamwork. If the student has experience working or undertaking placements with Specsavers, they will be able to progress through this stage more quickly. Facilitating clinical learning opportunities is a key competency of clinical supervision. Allow the student multiple opportunities to observe you consulting with patients, and, if possible, also allow them to observe other optometrists in your clinical team. Where you have multiple clinics running, you may wish to implement a system to alert the student to interesting cases, for example, a pager or buzzer. Offer the student the opportunity to observe interesting findings through the slit lamp and ask for their opinion. Encourage active observation by asking questions during or after the consultation. Thinking aloud as you perform an examination is also a useful strategy to facilitate learning, ensuring the patient is aware that you're doing this for the benefit of the student and that it is done in a way that doesn't negatively impact the patient experience. For example, using phrases such as, "The reason I am doing it this way is," "The factors I am taking into consideration here are," "I am weighing up the options of," and finally debrief to consolidate learning. There are multiple learning opportunities in each examination, even where the consultation seems straightforward. Even for short duration placements, opportunities to undertake practical testing on patients are highly valued by students. Start by asking the student to perform parts of the consultation. For example, allow them to take a case history or perform a subjective refraction before you complete the rest of the examination. Where possible, then allow the student to perform a complete examination under your observation. If you're proceeding to parallel consulting, it is always recommended you observe at least one full consultation prior to doing so. The parallel consulting model is used widely as part of internships and training for health professionals. It means that the supervising optometrist still sees the same number of patients as they would without the student present, so there is no lost clinic capacity. Each hour, 3 patients are booked. For example, patient 1 and 2 arrive at 9 a.m. and the supervisor and student commence testing. At 9:20, patient 3 arrives and is seen by the supervising optometrist, while the student continues their examination with patient 2. At 9:40, the supervisor finishes with patient 3 and joins the student for the remaining 20 minutes of the hour allocated to the student to observe and verify the findings and management plan. Other than examining patients, it is anticipated that students will also gain experience in non-clinical elements, such as practice management, including clinic coordination, handling patients, including patient communication at all stages of their journey, and dispensing, including frame and lens selection, ordering and checking jobs, minor repairs and adjustments, and delivery of optical appliances. Throughout the placement journey, it is important to communicate effectively with the student. Take the opportunity to debrief after each patient to consolidate learning. Ask open questions to encourage the student to reflect. For example, what did you learn from this case? Starting with open questions will help you understand what's important to the student, so you can focus on these areas as a first step. Recognising it won't always be possible to debrief after every patient, ask the student to keep a log of patients seen, so you can debrief at the end of each day. Provide regular, timely, specific and constructive feedback to the student. Effective feedback is that which gets the message across clearly, is accepted by the receiver, and results in a positive change in performance or behaviour. It's important to adapt your feedback methods to suit individual learning styles, and complete each feedback session by agreeing on priorities and an action plan. For placements longer than 1 week in duration, it is recommended to allow at least 1 hour of protected time per week. This is in addition to an ongoing open door policy, corridor chats, daily debriefs, and general case discussions. Potential topics to add to your protected time agenda include self-assessment. Ask the student to reflect on what they've done well and areas for improvement. Also ask them to identify wins and challenges, and work together to develop solutions to any challenges. Review their learning objectives and learning plan to assess progress. And also plan for the upcoming week. Set goals and address anything you or the student may need to do differently next week. Placements are rare. It is important to note that the graduate recruitment team are available to support in resolving any issues. Please contact the recruitment consultant who arranged the placement if any concerns arise. For example, if you foresee difficulties meeting the university requirements, such as achieving the targeted number of consultations, if the student does not attend as scheduled, or if there are any issues with the student's attitude or conduct. When placements are managed properly, there should be no negative impact on capacity or clinic revenue. To effectively manage the clinic flow, consider your appointment book setup. During the early stages where the student is observing, no adjustments should be needed. As the student progresses to testing independently, set up their appointment book to allow 1 hour per consultation, and block out your own diary to allow time for checking in on the student and reviewing the patient as per the parallel consulting model. Do not open the student's appointments to accept online bookings. The supervisor and other optometrists working should be using a rolling clinic to minimise wait times for patients. The student should have their own clinic, so patient expectations are managed appropriately and informed consent is obtained as part of the booking process. Appointing a team member to the role of clinic coordinator will take some of the pressure off the supervisor to ensure that the clinic is flowing smoothly and patient wait times and experiences are not negatively impacted. Patient selection is also important to ensure a seamless experience for students, supervisors, team members, and the patients themselves. Seen by a student must provide verbal consent, and this should be documented in their clinical records. Be clear that consultations with the student will take additional time, and don't book patients who are in a hurry. Start by booking patients with simple or straightforward presenting complaints, or returning patients with history on file. It is important to select appropriate language for patient-facing conversations. For example, when asking the patient about having a student observe, use a phrase such as, "Mrs. Jones, we have an optometry student who is in the final stages of his training working with us. Are you happy for him to sit in during your appointment and perhaps ask some questions and perform some parts of your eye examination?" Or, when making an appointment for a patient to see a student, "Mrs. Jones, we have an optometry student who is in the final stages of his training working with us. Are you willing to have him examine your eyes first before one of our experienced optometrists checks all of the results? It will take a bit longer to go through the process as you'll be receiving 2 professional opinions." Set up a student profile in Socrates or Genesis. The student should maintain clinical records. However, it's ultimately the supervisor's responsibility to check these and ensure they are accurate and adequate. Please refer to the Socrates or Genesis student test procedure for a full explanation of these procedures. For a clinical service to be eligible for Medicare benefits, you must have attended to the patient and been involved in their management. Medicare benefits are assigned based on the length of time the supervisor is in attendance. You will need to log out of the student's profile and in under the supervisor's profile to complete the billing process. In addition to the general considerations outlined in this video, it is also important you understand the university-specific requirements of the placement type you are hosting, so please ensure you also watch the relevant video. If you have any questions prior to or during the clinical placement, please do not hesitate to contact the relevant graduate recruitment consultant. Thank you again for hosting a student and for taking the time to watch this video in preparation for the placement.